What up, people? Okay, the press conference is over. I'm filming what I wanted to film. We don't want them to shut down the city again. Because a lot of people need to get back to work with their money. A lot of businesses need to be open. So let's be safe, people. Let's do what we got to do. I know I said that a few minutes ago, but we got to just practice what we preach. And get out there and do what we got to do. All right? I know it's tough. I know it's very depressing. I know it is very depressing. And
our averages are currently 2,695 cases a day over the last 7 days and 45 deaths a day over the last 7 days. Of the 85 deaths in LA County that were not in Long Beach or Pasadena, I want to share you some further statistics. 72 of them, or 85%, had some sort of comorbidity, which is the term we use to describe pre-existing health conditions and age vulnerabilities that make them especially vulnerable to dying from COVID-19. 57% of our deaths were men, and the ages of the deaths were widespread, including 3 deaths among people between 18 and 29 years of age, and 7 people between the ages of 30 and 49. 17 of the 85 were in congregate living settings, and that percentage is way down from the beginning of this, when you recall half of the deaths we were experiencing were in congregate living.
Grim. It's all terrible.
Of the total deaths that we have now in Los Angeles County, over half of them remain institutional, excluding again Long Beach and Pasadena. 2,222 are in institutional settings. 2,021 are deaths outside of institutional settings. And here's an even more interesting statistic. Outside of our institutions, in other words, in the general public at large, outside of those institutions, 2/3 of the deaths are men and 1/3 are women. So men,
wow.
Mask up.
Terrible numbers.
Men, take responsibility and socially distance. And men, make sure you are washing your hands and your surfaces. Our hospital inventory remains stable, and across the county, there are 600 available beds, including 465 acute care beds and 135 ICU beds currently available, as well as more than 1,250 to be exact, available ventilators as I speak. And while the county's hospital demand shows overall a much higher number of hospitalizations in LA County than in months past, there's some good news, which is that we're now seeing a steadying of our hospitalizations. And this will only further improve if we keep up our hard work to flatten the curve down further. Today we have 550 ICU patients who are severely sick. And to everybody who has lost somebody, my heart goes out to you. And to everybody who's watching somebody hang on in the ICU, we are with you in our thoughts and our prayers and our love. Those 550 ICU patients represents a 17.3% increase from last month, but it is almost a 12% decrease from just last week. Also, some nominally good news. And as of today, 1.7 million people in the county have been tested, and the cumulative positive testing rate stands at 10.1%, up slightly from last week at 9.7%. Within the city of Los Angeles, at our drive-through and walk-up testing sites, we have tested nearly 1 million people, 920,000. And the cumulative rate of persons who are testing positive in those sites is 6.9% in the city of LA, up a little bit from 6.4% last week. So hospitalizations are coming down slightly. We're seeing cases come down slightly, but we're also seeing positivity go up slightly, even as the infection rate comes down. I know those can be confusing. To summarize, it's still fragile.
Very confusing.
Your work is making a difference. We're not seeing all of them go up, but not everything is going in the right direction yet. All Angelenos need to exercise extreme caution, and if you think you've been exposed or you work in a high-risk environment, go get tested at your doctor or your medical provider, at a CVS, a community health center, or a city, county, or state site. And we have the capacity at city sites alone to test 18,500 people this week. We're continuing to send our mobile teams out to folks who might not be able to get in a car or walk to a testing center. This weekend, I joined the mobile testing team at Nickerson Gardens Housing Development And today, our testing teams are out there proactively offering without appointment tests at Central Lutheran Church in Van Nuys and the William Mead Housing Development in Lincoln Heights, north of Chinatown. Tests are free for anyone with or without symptoms, but prioritized for people who have symptoms, who think they've been exposed or who are essential workers or work in high-risk environments. As always, find out where the nearest testing site is to you by going to coronavirus.lacity.org/testing. And if you'd like to schedule through the city, you can fill out the form there today or call 311. And remember, when you get a call from somebody from the County Department of Public Health, this is a contact tracer and a critical call that you should answer. Or if you get a voicemail, call back. These are not law enforcement officials. They won't ask you about your immigration status. They're here to help protect your loved ones and coworkers and family members. They need to know who you've been in contact with so that they can isolate and quarantine, and we can continue to save lives. We're continuing to look for ways to make this reality and this adjustment to COVID-19.
I am so sorry for the airplanes.
To make our cities
I live in
safer
a
and
flight
make their lives
of LAX.
We know that some people are still traveling for essential work. And last month at LAX, I announced that we were setting up thermal cameras
So
at
sorry
Tom
for
Bradley
noise from
Terminal
airplanes.
outside the terminal. The first
I live in a
airport in
flight
America
path
to do this
to LAX.
before people go into the
In Los
terminal.
Angeles.
As a pilot project to help identify travelers with body temperatures over 100.4 degrees, because we know that is one of the leading symptoms of COVID-19. Our next step that I'm announcing tonight to stop the spread of COVID-19 is our new Travel Safely Ambassador program at LAX. To encourage passengers to wear masks, which are required at LAX starting on Monday, our Travel Safety Ambassadors will be at Terminal 1, and they'll hand out free masks to those who need them, as well as fact sheets that are detailing all of the safety measures that are in place in our airport. So you can have the peace of mind when you travel, and we can all stop the spread. It's the deep cleaning that we're doing in highly trafficked areas, the 250 hand sanitizer stations that are all around you. And these ambassadors will be easy to spot. They'll be wearing travel safely buttons and standing next to signs encouraging mask use. Ultimately, the goal will be to have ambassadors at every single terminal. We'll start with Terminal 1 and Tom Bradley. As resources and staffing allow us to get there, we want to have a world-class airport that provides you with world-class safety. We're doing everything we can to protect everybody who's in need, to protect the most vulnerable, to stop the spread, and to save lives. One of the ways I've shared that we're doing this in Los Angeles County and the city as the partner with our county government is Project Roomkey, a state and a county and city initiative to rent hotel and motel rooms for Angelenos experiencing homelessness who are most at risk of COVID-19. Tonight, I share good news with you that we have secured yet another hotel, this time in the southeast San Fernando Valley, adding another 150 rooms, bringing the total number of hotel and motel rooms to nearly 4,200 across the county. We always have food providers and service providers at each hotel. I've worked at one of those hotels handing out food. It works incredibly well, and it keeps all of us safe. I'm extremely grateful to everybody who is working, especially our disaster service workers, OLASA, and our service providers who are making Project Roomkey work. And we're working with Project Homekey, the state initiative to make sure people go from those hotel rooms to permanent housing as well. But one thing I've made clear each night is there's only so much that we can do locally. We need help from Washington. And boy, do we feel that this week. Too many Angelenos are facing that cliff on Friday of unemployment benefits that will run out. You're not sure how you're going to pay your bills, stay in your housing, feed your family. All of the stress that came at the beginning, which Congress stepped up and helped us get through, now partisanship threatens. And right now, on Friday, it may be that Congress does not bring together a solution to extend those benefits to Americans who are hard hit and hardest hit by COVID-19. Today, we heard from the White House that we are, quote, nowhere close to a deal. Well, before Congress or anybody else in Washington, D.C. takes a vacation, before they go on a break, they should do what we're doing, working around the clock. Everyday Americans who are struggling to get through this crisis, and they need to do their job and extend unemployment benefits, bring local and state aid to those first providers, those first responders and providers who are working in our hospitals and answering our ambulance calls, and make sure that we step up as a country, unified, united, tossing aside partisanship to do the right thing and to help Americans in their time of greatest need. This Friday, July 31st, those expanded unemployment benefits expire. 830,000 of them live here in Los Angeles. They had filed claims by July 4th, and they are counting on you to do the right thing. The easiest thing to do would be for the Senate to pass the HEROES Act, which has already passed the House of Representatives. It could happen as quickly as tomorrow and bring aid right away. And additionally, I was happy to hear the news today that a federal judge in New York blocked the government from implementing the public charge rule nationwide. In the midst of a public health crisis, this news gives immigrants the peace of mind about accessing life, saving resources for themselves and families, and does not discriminate against immigrants who contribute so much to America. If you need care to prevent or to treat COVID-19, you should be.
Hey, what up, people? How y'all doing? It's your boy D House in the building. So, periodically, I watch the conference, the news show, for the press conference of the mayor of Los Angeles, city of Los Angeles, and sometimes his news is good, but this time he looked so drab, and it looked all bad. Some of it was good, some of the numbers are not going up as high. It seemed like beds are freeing up, people are not getting as sick as they were. But still, a lot of people are dying from it. It's COVID-19. And he's still saying that we got to do better. Attached will be a following video of the news conference. It's about 10 minutes long. So I just want to put it with this video. And then I'll have some comments at the end of the video related to this whole situation. I just think we just got to pray, everybody. You know, do what we got to do. Make sure we do the right thing. And just handle our business, man. Just do what we got to do. Listen to what they're telling you to do. Just be safe.